Okay, we're going.
Okay, my name is Lacey Larson. I'm doing the newborn assessment pass-off. I'm going to do hand hygiene and put on gloves. So the doctor is going to hand me a naked baby, so I'm going to take, oh, we forgot to take that off too. So I'm going to take this off. Okay, and then I would have this warmer turned on, so the baby wouldn't be cold. Okay, pretend we didn't get the baby yet. Okay, here's the towel. So we're in this warmer, or like all the mom's abdomen, whatever. Okay, so we have this naked baby, and we get it, and we like warm it and stimulate it. I meant dry it. Dry it, stimulate it, get it breathing, and then, okay, we dried it off pretty good. So we're gonna get rid of this nasty towel. And then, I wouldn't hold it like that, but it's a doll. I don't know how I would hold it. Okay, so, we're gonna listen to its heart and lungs really quick. It's breathing, its heart's good. And we're gonna do the 1 minute APGAR. So the appearance, the pulse, the grimace, activity, and respirations. So it has a 1 minute APGAR of 8. And then we're gonna put an ID band on. And we'll do some vitals. So I'm gonna put a little hat on too. What is it called? The blood pressure is 80/46. The pulse, I'm gonna listen for a full minute. And the pulse is 110 to 160. And then I'll listen for a full minute for respirations, and it's supposed to be between 30 and 60. And then the pulse ox is supposed to be above 95. So pulse ox temp is, I would do an axillary temp, and it would be between 36.5 and 37.5. Okay, hold on. Pulse ox, pulse, blood pressure, temperature. Okay, so that's all for the vitals. And then for the APGAR, I would reassess at 5 minutes, and it's gonna be a 9. The body is pink, but the arms and legs are still blue. Okay, so I'm gonna take this naked baby and we're gonna weigh it. And it weighs 6 pounds 11 ounces. And then we'll go back here and we'll measure its head. So the OFC, whoops. I think, so that's 14 1/4. I think we do centimeters though, so I'm gonna just do both. So 36.5 centimeters, and we're gonna do his, it's a she. We're gonna do her chest, 2 centimeters. Right at her nipples, that's 33. And we're gonna do right above her belly button, because her umbilical vocal cords in the way. And that is 34.5. And then we'll do eyes and thighs. So erythromycin in the conjunctiva. It's a prophylactic for gonorrhea and maybe chlamydia or syphilis, I don't know. Gonorrhea for sure. Then we need 1 milligram of vitamin K, so 0.5 milliliters. This helps with clotting. So I'm going to do this on the vastus lateralis. Oh. Okay, and sharps. And then I think I'll put a diaper on her. Then I'm going to give her to her mama for some skin-to-skin contact. So I'll actually give her to her mom and then like wrap her up like on top of her mom. And then after like an hour or two, I'll bring the baby back for like a more thorough assessment. So, and then we're back on the warmer. I'm gonna check blood glucose. I'm doing this now so I don't forget. Right on the edge of the heel, so like right there. Check blood glucose. And it shouldn't be below 40. And then, okay, so we'll start at the head. So I'm gonna check the fontanelles, anterior and posterior. I'm gonna check for caput and cephalohematoma. Caput is just like swelling above the skull and it can cross suture lines and it goes away within a couple days. The cephalohematoma is below the periosteum and it does not cross suture lines and it takes like 6 to 8 weeks to resolve. So that's the head, and then I'm gonna check the eyes. This is a pretend flashlight. I would check for perla and make sure the eyes are like even with the ears, and check the ears, make sure they're patent and there's no skin tags on there. And then check the nose for nasal flaring, which there's none, and just the airways are patent. And then I'm gonna check the mouth, and when she cries, I'm gonna watch for symmetrical movement, and then I'll check in the mouth for the milk teeth or Epstein pearls. And then I'll check the palate and the lips, make sure they're like all formed correctly. The palate is intact, and then the sucking reflex. So I'm gonna do reflexes too. So the sucking reflex, the rooting reflex is if you tickle their cheek and they like move toward it. And then the Moro reflex is if you like hold them and then they startle, and then like that. And then the Babinski reflex is if you like do that and their toes flare out. And then this one's better. This is when they curl their little toes around your finger. That's the plantar reflex. and this is the palmar reflex. And then the dancing reflex is if you do this and they like move their feet like they're dancing, or like they're walking. I feel like there's another one. The tonic one, if you like move their head that way, then they're like, they put this arm straight and this arm back like they're fencing. And that's all like good neurological stuff. Okay, I'm gonna check the collarbones for crepitus or bumps, indicating a fracture. I'm gonna check the arms, like pull them down and then see if they like flex them up again. I'm gonna check the brachial pulses and the femoral pulses. I'll check all the cap refills on their chest and their fingers and their toes, and I'll check that they have all their fingers and there's no skin tags. Check they have all their toes, no skin tags. Check their palmar creases, and it looks like there's 2-ish. So that's a good sign of no genetic defects. Check their feet for creases. There's some creases. I'm gonna check the skin for turgor and color and like desquamation. And I'm gonna check the back for like just checking that the spine is straight and looking for neural tube defects. And there's no like dimpling above the buttocks. There is a Mongolian spot that's it's like a purplish bluish spot, and it will fade over time, and there's no treatment for it. You don't need to do anything. There's a stork bite right here, like a port wine stain, and there's no treatment for that either unless you want to like do laser therapy. And that's pretty permanent. There's another thing. Oh, Melia is like little white dots on her nose, and that's super common, and there's no treatment for that. You just leave it. Don't try to like pop it like a pimple or anything. Okay, so I'm gonna check the umbilical cord and see that there's 3 vessels and there's no like bleeding or pus or any signs of infection around it. I'm gonna listen for bowel sounds in all 4 quadrants. Bowel sounds are good. Good, active bowel sounds. Okay, check the genitalia. On a male, I would check for cryptorchidism, that the like testicles aren't descended into the scrotum, and check and make sure the meatus is at the tip of the penis instead of like on the top or the bottom, just right at the tip. And if they were already circumcised, check for that. Just make sure there's not profuse bleeding or like pus or any there probably would be redness or swelling, but just check on that and assess that. For a female, I'm gonna check the labia minora majora, and then make sure there's we'll just check on pseudomenstruation. If there is, that's okay, but yeah, not a ton of bleeding is normal. So genitalia. Oh, I would note their first meconium stool and their first voiding. Make sure that that is working. I feel like there's something I need to do with the legs. Give a shot. I don't know. Overall, I would just look for like any major anomalies. Check the skin. See neuro. musculoskeletal. So just make sure like the wigs are working. Like you can check, make them go straight and see if they recoil. I can't think. Got that thing on. It's reflexes. I can't really think of anything else. Okay, so I'm gonna give it back to the mom, do skin to skin, and then put the blanket on top of them. Or I could just swaddle it if the mom needs to rest. And then take this baby to the nursery. I can't think of anything else. So, gloves and hand hygiene.